welcome back to School of Speech, presented by Speech Therapy PD. School of Speech is the podcast where school-based SLPs can come together to really spotlight all the work that we are doing every day in our schools. I'm your host, Carolyn Dolby, and I am so excited you are here today, and so will you. Today's episode is titled Research Practice Partnerships in Pediatric Speech-Language Pathology. That's a lot of P's. I know that when some of us hear research, we think, wait a minute, that's just for the universities. That's just for those writing journals, right? That's not for my therapy room. And when we hear partnership, are we thinking, wait, are you adding one more thing to my workload? But hey, what if we reframe this? What if research wasn't something done to the schools, but something built with the schools? What if school-based SLPs weren't just consumers of evidence, but maybe co-creators of it? So if you have ever thought, why doesn't research match my reality? Or how can we make evidence-based practices actually sustainable for ourselves? Well, if you've ever thought something like that, you are in the right place, because I am joined by that's right, we have three incredible leaders today that are going to be bridging the research and practice in a really meaningful way. First off, we have Dr. Tim DeLuca. He is an assistant professor at the University of Massachusetts, Amherst, and director of the Community Engaged Language and Literacy, or CEL, lab. His work focuses on improving language and literacy outcomes for students with developmental language disorders, dyslexia, and complex communication needs. He's had over a decade of clinical experience. Tim is really deeply committed to the implementation of science and building authentic partnerships between researchers and school-based clinicians. Ding, 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 why we're here. Tim is also, let me just say, y'all, he is a returning guest. And if you haven't had a chance to watch his episode on DLD and dyslexia, I'm sorry for you, because you are going to want to go back after this. And I really do encourage you to go check it out because he's amazing. But today he is also joined by Dr. Nerissa Hall, a fellow SLP. She is also an AAC specialist and the co-director of the Speech, Language, and Literacy Center with Tate Behavioral. She works across disciplines with a strong focus on sustainable implementation of evidence-based practices. That's what we're here for. Nerissa is also widely known for translating research into practical, real-world school applications. Ding, ding, ding. Listen to that, people. And then, last but never least, Julia Serra, also speech-language pathologist extraordinaire, and also a supervising clinician at Tate Learning Center. She collaborates closely with interdisciplinary teams to support students with complex communication, learning, and behavior needs. Julia brings a grounded, clinician-informed perspective on what it truly takes to apply research with fidelity, with flexibility in school settings. Welcome, Tim, Nerissa, and Julia. Thanks for being here today. All right, let's do disclosures. I am a salaried employee at Portland Public Schools here in Oregon. I am the co-founder of A Place to Start Therapy, and I also receive compensation from Speech Therapy PD for hosting School of Speech. I'm also a member of ASHA, and I volunteer for Feeding Matters. Tim is salaried at the University of Massachusetts Amherst. Nerissa and Julia are both salaried employees of Tate Behavioral, all three of them. Oh, and we're all ASHA members, whoop, whoop. All right, with no other non-financial that we need to disclose at this time. But I have a question. I have a big one. I have a big picture question, actually, and this one's going to go to Tim. Are you ready, sir? All right, I'm so glad you're back with us today, because here's what I want to know. I really want you to start. I want to know, what exactly is research partnership? I didn't even say that right. Research practice partnership. Oh my God, you guys.
There we go.
What is it? Help us.
Well, yeah, let me get into it. I want to first start off by thanking you for such a wonderful introduction. I also feel like you set up this topic so nicely, because two things you mentioned. When we hear research, we often think about the researchers doing the research, and I think it perpetuates this power dynamic that is well documented in our discipline of speech-language pathology and probably doesn't serve anybody very much, right? If we're not working together, we're probably not really working. And another thing you mentioned is that when we think about a research practice partnership, it could feel like another thing. And I think as we all talk today, we're going to talk about how, yes, there are aspects of this that require effort and require us to put in some extra work, but also hopefully in the long run, we're thinking about building sustainable practices, sharing our workload in a way that makes everything manageable and doesn't make it feel like just one more thing. So let's start off by defining what a research practice partnership is. It's kind of exactly what those words are. It's researchers and practitioners working together. There is a lot of research about research practice partnerships, actually, especially in the field of education. So a lot of us here are school-based SLPs, so we're thinking a lot about that school-based practice. There's a lot of research practice partnership research, all in speech-language pathology, in math, science, social studies, all these different topics, behavior support, social emotional learning, things like that. A lot of that work is being produced. I think SLPs are getting into this more and more in a more formal way. And I think it's something that maybe the SLP discipline's been doing for a long time, but now we're really defining it. We're getting stronger with our methodology, getting stronger with how we're disseminating and talking about these ideas, and trying to make sure that we're really leaning into building true partnerships. So research practice partnership, it's a long-term collaboration between practitioners and research. And the goal is that we're investigating problems of practice, meaning that we're addressing things that in real life are happening, that are challenges for school-based SLPs. And we know a lot of times as a school-based SLP, we have plenty to do. So thinking about how to disseminate some of the good work you're doing, thinking about how to step back and address a problem in a new way can feel a little bit overwhelming. So one of the nice pieces of a research practice partnership is that there's somebody else there who maybe has different resources, a different lens to look through things. Also, as a researcher, benefits a lot from understanding what the realities of school-based practice are. If I'm doing research that has no grounding in reality, that research probably doesn't matter all that much. I think we mentioned this word a few times now between the two of us, this word sustainable. When we are working together, we want to make sure that we're not just popping in as a researcher, especially I'm not just popping in and saying, hey, can I collect data here? And then getting on out. That would not be a partnership at all. That would be me coming in to collect data. So this is something where we're really trying to build an authentic relationship where I'm not just coming in with my own research agenda, but rather we're thinking collectively, the school team and the researcher, to think about, okay, we both have things we need to get out of this. As a researcher, I need publications, I need to be applying for grants. As school-based SLPs, you need to be meeting the demand of your workload, your caseload, and there are probably different clinical problems you have to address. If we take those two things together, can we build some sort of shared goal? And if we can, that probably means that we're on our way to building that really authentic relationship with that shared goal. I think that's my big overview for now, yeah.
Okay, I have so many questions. I really do. So, I mean, first of all, because I want to know how this all begins. So I'm thinking, since you have Julia and Nerissa here, maybe rather than just giving me a general answer, what if you guys talk about how you began your partnership, and that might answer my question. So kind of like, what's your meet cute, guys? How'd this happen?
Did it all start with an email? Just one simple email?
I think it did. It was just one simple email, but it was pretty loaded because having gone to UMass, I listened to Tim do a fantastic podcast, and he talked about literacy and AAC, and that's a real passion of ours and something that we're exploring. And at the end, he said something about, I really do want to collaborate with local schools and districts, so just reach out to me. And I was like, let's see, is he actually going to do it? So it was very much, I told Julia, I'm like, what do you think the chances are that he's actually going to write back? And it was probably within about 24 hours. And then it was within a week, I would say, that we found a time, and Tim came and he said, let's just get together first. We didn't have to have a clear idea or plan. I think we already knew that we were in the same interest areas. And I think one of the things that I heard both of you say a number of times was around the partnership and what that meant. And I think having gone through being very much a practitioner myself and also having gone on to do research and, earn a PhD, I am very acutely aware of how stifling the researchy component can feel. But, I think Tim is excellent and brilliant and also came in very
Agreed.
clearly. Yes, I know. Let's see if we can make him blush. But I think what was so important about this, which I really want to share with the audience, is that we worked together to establish our own needs assessment, essentially. It wasn't that, Tim came in and it was like, oh, this is what I need. This is what I'm pursuing. Can I please make sure, this is what I want? It was, tell me, let's see. Let's meet the kids. Let's really come together and share the same space. And I think from there, we were able to establish way too many goals. We have big dreams, the three of us, but we're very good at trying to moderate it. And so we were able to identify a few really tangible starting points, which makes it very applicable for us as providing practitioners. So just a little bit of background briefly, although we're working in a private day school, we are working with learners with really complex communication behavior needs. Almost everyone has a diagnosis of autism. And I would say about 95% of our population is working or using augmentative and alternative communication. And we're really trying to drive literacy. And so we have a really complicated demographic and a really complicated topic, teaching kids who aren't communicating in traditional ways to read and to demonstrate that understanding is really challenging. And so we were really motivated ourselves to get that input, another set of eyes, access to a wider resources. And Tim is very hands-on. So we get to see him or members of his team weekly, which I think is another part. It's not just swooping in and then swooping out and sharing information. It is very shared and real. And then I think a lot of, I want Julia also to add into there, but just a little funny fact, we kind of did our own Who Wants to Be a Millionaire, and I got to phone a friend and I, messaged him. I was like, I need to phone a friend. And he was like, give me an hour. And, we're able to say little things like, how do I help represent symbols? And for someone who can't break down, not symbols, syllables in words, and how do we represent this? And Tim was able to say, well, this is the research, but let's think about this learner. And he knew the learner. And so therefore was able to help us be really tailor the support uniquely. Julia, what did I miss?
I just wanted to jump in for 1 second because what I'm hearing, because I have been a school-based clinician forever, and what I'm loving is it's not, Tim, you coming in, telling somebody what to do and then leaving. Who out there likes that? No one wants to be told what to do and then they leave when they don't know seriously the situation. So I'm really sorry I had to jump in, and Julie, I want you to come in, but I wanted to make, that just feels good. You're painting the picture of partnership, which I love, versus you're not using the word consult. Like he's not just a consult, even though he's a phone a friend, like that, you've got that relationship. Okay, I just wanted to jump in for that. All right, Julia, give us more.
Well, like kind of adding on to that, I like to think of Tim as like our own Google search engine for research, or our own encyclopedia, because any question we have, we do phone him and he like has some type of research answer and then we just put it down in our notebook. And so we know that we are providing really nice evidence-based practice. I think we, as school-based SLPs, we have a lot of pressure to go in and do our jobs really well. And with that, it's trying to keep up with the continued learning of evidence-based practice in the implementation science. And because our days are really beefy and we see really intense kids, we can't really, it's not really feasible all the time. I think especially because with the population that we're serving primarily at Tate Learning Center, they're really complex, like Nerissa had said. And so a lot of the research it's not one size fits all. And so a lot of the literacy curriculums that we try with our students, we really have a hard time with choosing one to service all 35 of our students in our school. And so collaborating with Tim and having Nerissa's beautiful mind for implementation science, we work really, really hard as a team to put out some really nice evidence-based practice. And so
Thank you. So I know that you're a small day school, private, and I know that we've got school-based, private, and public. The gamut runs the gamut. Why, I guess my cheeky question is, why should school-based SLPs care about school-based or about research practice partnerships?
Do you want me to start with that one from a research perspective, and then you both jump in as no?
Oh,
Go ahead.
No, because you
Go ahead.
obviously you know why you want it. I think as practitioners, and both Julia and I also consult outside of our school, so we are working a lot with school-based SLPs in our community in a consultant model where we come in and we're the expert, and which in our practice in particular, we really, really try to promote more of a collaborative approach because we're all the experts coming in with different vantage points. But I think to what Julia was saying is our field is changing rapidly. We're learning at a really rapid rate the complexity of student profiles that are entering our schools. I mean, we are obviously coming from an AAC vantage point, which is, a niche within our field, but that not so long ago was low incidence. And now it's, when I was doing my dissertation, so few people either had to have training in AAC or they could get away with not having AAC on their caseload, but that's not the case anymore because the profiles of the learners are really much more diverse and dynamic. And so I think, as Julia said, it is hard to keep up. And then also to not become too stuck in what, making sure that we are getting those different perspectives, that different input. And I think when you get a really good researcher like Tim, who can be that really dynamic encyclopedia, who's also a clinician, and so therefore what he advises or brainstorms for one student is not the same for another, because you've got a clinician who is coming in at the same, like, he's not promoting a product, he's not promoting one type of intervention or approach. And therefore, we really do have this opportunity to get really tailored evidence-based practice, which I think is much easier getting it from Tim or like that kind of dynamic than trying to find the right course or necessarily the right article. And then if I read that one, I've got to make sure I read the other ones. And he's already done that. So that's my response, but I don't know what else people want to add.
just to add to that too, I think families are really passionate about the quality of their child's interventions. And so to help them have kind of like that understanding of like, okay, I can trust the clinician is, doing their due diligence and keeping up with the research and staying on top of, the needs of my child, that might help them feel a little bit better.
I like that. I like
Well-
always pulling in the family. I like that. Thank you, Julia.
Yeah. I want to quickly zoom out because earlier you both said really nice things about me as partner, and I want to like kind of also highlight a few active ingredients that I think make our partnership really, really successful, that I think are generalizable across any partnership that's going to be formed between researchers and practitioners. I think that, you all pointed out that we're able to actually work with kids together, see kids together. I think that speaks to both of your ability to be vulnerable. And I think that's hard for a lot of SLPs. I know it was something that was really, really hard for me early in my clinical career, something I got much better at. is being able to just say, hey, I need some help. Can you help me think through this? Can you come look at this with me? And welcoming in another person, that is a really, really powerful thing that makes these relationships, again, authentic and allows us to continue working and moving forward and having that back and forth within our relationship. So I think that's just such an important thing to point out, that there's vulnerability there. And then there's also that welcoming aspect that you both have about you, in that, I'm welcome in your spaces, which thank you for giving me space. And I'm welcome to check in with you and get your feedback about things as well, which again, you both have really, really busy schedules, but we kind of do that give and take and find time to make sure we're both parties, the researcher and the practitioner, are getting things that they need out of this relationship. So those are kind of just two active ingredients that I think are super, super important for both the researcher and practitioner in building these kinds of relationships. And both of you kind of spoke to this as well, is that you both work in populations that are, I guess oftentimes cited as low incidence populations, and therefore research in these populations is super heterogeneous. There's a lot of different kids in case studies, and it's really, really hard to apply that to our clinical practice. The other part that's hard about that is that a lot of the research that exists in our discipline is not implementation research. It's done in a lab setting, it's in a more controlled environment. Even if it is performed in schools, it's often in a controlled or contrived way. And that makes it really, really hard to think about what from there can I actually pull into my space? What from there makes sense in this space with this learner? So being able to discuss that together, you as the experts in the learners, you as the experts in doing, and me and having the ability to take time with the methodology of that study to understand it, I think benefits both of us as far as our collaborations and the research we build together, but also benefits our learners every day, because we're able to kind of more directly create impact, hopefully, for the students we're working with. The other thing I kind of wanted to touch base on there related to research practice partnerships is that I had one more thing there. What was it? Something about how we're so sustainable. I've lost it.
It will
I'm sure
come
it'll
back.
come back.
It will come back. It will absolutely come back. So Susan, I see your question. I'm going to ask that question in 1 second, and then we're going to come back because I want to go back. No, we're going to start with a question, and then I've got a question. All right, Susan, thanks for your question. Even though she says she'll probably ask this later, or answer this later, but I was at thinking the same thing. How do you find researchers that are willing to be as involved, right? Danielle was like, I got that same question. Okay, so my question is the same as this, but different. It was not only how to find the researcher, because it could be, no, you know what, let's start with that. I'm sorry, why am I muddying the waters? How do we find more of you, Tim?
So, great question. Carolyn, I think you asked me to do this because my colleague Brittany Chulo and I presented on research practice partnerships to support kids with DLD and dyslexia in schools at ASHA. And one thing Brittany and I, almost Dr. Chulo, she's almost graduated, worked on and are going to hopefully develop a little bit more is actually creating a database of people who are willing and excited to be in research practice partnerships, both researchers and clinicians. I've strong-armed a few colleagues to be in that document so far. I think we have to build it a little bit, but maybe it's something I can share as a resource for the future. And hopefully it's something we continue to build out so that there's just names and people and places associated so that you can kind of see who might be near you. I also think now with technology, it can be somebody really, really far away. And go ahead, Nerissa.
I was going to add to that point too, because I think it's how do we find people like you? And then what if we're not like neighbors, and then what? And I think, one of my big passions too is like tele-AAC and or telepractice and that asynchronous component. And I think, we are fortunate to be able to have ways of kind of share, like how empowering the researchers to still be able to view, obviously managing the right consents and permissions and data protection and stuff. But I do think that a database, like you're mentioning, Tim, combined with the technology that we have, like there could still be really effective ways to create this long-term, reciprocal back and forth sharing relationship.
I'm thinking, for all of us, we're all over the country. You saw everybody all over the place coming in the chat. You guys are all over thinking about partnering with your local university and the researchers there. But I guess when you start, so that would be a way. But I want to say, that Tim said, and tell me if I'm lying, you said that you are working on a database of researchers that are interested in creating research partnerships. Is that correct?
That is correct. We have a document somewhere. It definitely needs to be updated, but we have a document somewhere. And also clinicians. I think it's important too. Clinicians can be in there. So if there are researchers who want to do this kind of work, they could be reaching out and initiating the conversation with clinicians. One of the things that Brittany and I talked about in our presentation when we were brainstorming with people who we know are engaged in these kinds of successful relationships, we thought about how these relationships are initiated. And oftentimes it's a pretty simple Google search of, hey, am I, like you said, my closest university or college who's doing this kind of work? Can I send them a quick email to try to connect and see if they're interested in talking about this more? Or can I just see who's publishing the most in this area, or doing podcasts in this area? Who have I heard about doing this work? And can I just send them a quick email to reach out? They might be willing to engage with you from afar, and they also probably have colleagues closer to you that they also might be able to connect you with. So those were two of the things that Brittany and I were thinking about as well when we were thinking about specific ways we can initiate these types of partnerships in the future.
Also, I'm
sorry.
sorry, just to add to that, and we might get to this much later, but for those who are viewing and you might reach out to researchers around your area, if you don't find success in that, maybe another search would be like community of practices around your area. And so that would help with finding researchers that are, establishing community of practices that might be, remote. And so you don't have to be neighbors, but you can connect virtually.
Yeah, I love that because it's true. It is a small world now. And we are doing so many things virtually like we are now, which is amazing. So I think that does open up the world. But what I also heard is that, Tim, you might be interested in getting maybe some clinicians that would be interested in different areas of study. So those that are listening, if you are interested, Tim, would you be interested in getting information from the clinicians listening?
Yeah, the goal for Brittany and I was to have this document with different subclinical areas. So feeding, voice, swallowing, AAC, all the different kinds of things we might be doing, and just having different sections within the document where people could leave their information, leave an idea of what they're interested in pursuing, whether it be a clinician or a researcher, and then see other people on that list who might be a good connection. And great question, will the database be available on my lab's website? It should be. That should be there. So hopefully in the future, it will be there.
All right, so that's where it will be because we're still working on it. Okay. Oh, thank you, Cece, because I was going to bring us back. Let Cece bring us back because she's asking, will we discuss how the process can look from start to finish? Yes. Including an example of a topic you've researched and how the partnership looked. For example, who did what, the time involved. Let's start at the very beginning. How to get started, what did it look like, and who did what?
So we have kind of 3 different projects that we're working on together. One is to support word reading for students who use AAC. Another is thinking more holistically around just building opportunities for initial emergent communicators to engage in language and literacy. And then the third, like Julia just mentioned, is building a community of practice out here in Western Massachusetts. And maybe we could talk through what the word reading study looks like and kind of what that has been. So previous work I've done with a huge team, this is work that Janice Light's done for a long time, and her team in AAC is building software that supports word reading for children who use AAC. And the work so far has looked at researchers coming in and implementing this practice with students in schools. Right now, we're studying together is using this same AAC feature that models how to decode words for AAC users. We're actually now having practitioners in the school actually implement using the app to see if the positive results that happened when researchers implemented the app could be replicated when people who work every day in schools are implementing the app. So what that looks like is me doing a lot of behind the scenes, getting a bunch of materials ready. And then Julia and Nerissa are really my partners in getting implementation up and running. And that's something that we're kind of in the thick of right now is we have a lot of participants in the school, both staff and students. We have the programming set up, but a lot of what we're working on together right now is thinking about how to actually make the programming happen. because again, we're kind of asking for another thing to happen within the school day. We've had to be mindful about reshaping that for the different people that we're trying to support. So we're very much in the thick of that now. Do either of you want to add to that, or how you're thinking about that project?
Yeah, I think I'm just thinking, Tim, we are so fortunate that I think we knew from the beginning it was going to be a great dynamic, because Tim was really mindful of being like, I don't want my agenda to drive your agenda. But I think part of my message to, like, we're really fortunate to have Tim, who's already doing that naturally, but not everyone's going to fit in within I think one of the things that I have a love-hate relationship around science and, well, this kind of scientific study in general, because I tend to have like really big hopes, dreams, visions, and you have to like really bring it down for, to get measurable results. And so I think what that also does is that means that some people may or may not meet inclusion criteria or be good candidates. And I think that while Tim is really good at being like, no, that's fine. Like, he's not looking for participants. I mean, obviously you are, Tim, but not to the point that if it doesn't align with what works best for the student, you're very gracious in being like, no, let's find something else, which is how the second project kind of transpired for those who are really emergent readers who aren't yet really decoding. And we're doing those are like pre-literacy things. So we were very fortunate that you didn't come in with that really narrow focus, and we're trying to recruit participants and, inadvertently like misserve them. But I think that would just be a message to, our audience too, is like, you are also the expert on the intervention, and feel free to guide that and be like, oh, nope, it's like, I think sometimes I just want to make sure, because the ultimate well-being is of the intervention of our learners and the intervention they're receiving. And we want to make sure that we are keeping our clinical thoughts and judgments at the forefront of that. And Tim, you're so good at doing it. And not to suggest that other researchers who are very invested in implementation science wouldn't be, but I just want as practicing clinicians, like, you're in charge of what you want the goals to be. And so make sure it works for you.
Nerissa, thank you, Nerissa. And what you started when you were talking before, you said the first thing was doing a needs assessment. So I guess, first of all, everyone listening is interested. That's why they're here today. They're interested in that research practice partnership. So, okay, so there's so many different topics out there. And so you're thinking, okay, I've got to find a researcher that is researching in that scope, right? For me, it would be swallowing. Other people would be, and for you guys, it's literacy. And for your kiddos, and your high need is AAC. So what I'm thinking, then you and Tim, you guys found each other for literacy and working with AAC. Is that correct? And then you guys got together and did a needs assessment, because Tim has what he needs, what he's thinking, but you guys are like, these are the needs of my students, because it has to meet the needs of the students. Otherwise, I could not imagine it working in a school setting. Okay, so we have the topic, you have the researcher that is an expert in that specific topic. Then we do the needs assessment of listeners, what your needs for your specific population is. Where do we go next?
Yeah, I love how you distilled this down. It's that both parties are coming with things they need, right? I need my publications and continued research profile. The clinicians need goals met for their students every day. Based on that currency we both have, we developed a shared goal. That shared goal, because we have such a unique population with whom we're working, looked different when applied to different students within the school. And that was kind of related to our needs assessment. We were really trying to think about who needs what within the school as it relates to AAC and literacy. From there, I did a lot of the protocol, right, of identifying what the actual research was, the outcomes we're trying to measure look like, and what the protocol for intervention looks like. But I'm getting feedback from Nerissa and Julia along the way to make sure it is feasible and functional for in their school environment. So kind of distilling that down, right, is that a researcher within a research practice partnership is probably trying to test some sort of assessment or intervention practice. And they probably have a pretty strict protocol that they have in their brain for that idea. And the role of the clinician there is to help break it down to think about what is feasible, what's applicable for this particular place we're in. And then from there, we have to get into really the implementation science of it all. I think you've heard all three of us mention that term. And that kind of brings me back to that point that I forgot earlier. The idea that a lot of research in speech language pathology, a lot is coming out now, but in the past was not implementation science based, meaning that there weren't studies that showed us how these great ideas researchers have developed in the past, how they can actually be applied in real life to real clinical settings. What are the implementation facilitators? What are the things that we need to put in place in order for something to work? What do we need to know about the context for something to work? And that's really where the clinicians are so valuable in reshaping whatever protocol idea I have in my brain to make sense in the real world. Along the way, we're measuring that outcome, and we might be adapting our implementation strategies along the way. And that's kind of where we are now, to try to get increased uptake by the different practitioners in the school to implement the intervention, and measuring student outcomes along the way. We're also going to be measuring staff perceptions and behavior along the way as well. That's particular to our study, but the big idea there is that there's some sort of outcome that we collectively agree is important to measure. Hopefully that outcome is not only relevant to my research, but also relevant to maybe what we need to report in our school. I know another line of research I have is related to implementing school-based language screening. Laws across 50 states, almost all 50 states at this point, require dyslexia screening. Now we're also trying to get screening for developmental language disorder in place in a lot of school systems. So that is a really nice example that I think is probably very clear for something a lot of school-based SLPs can picture, as far as what a shared goal might be there, and also how that data that can contribute to research can also contribute to things we really need in our everyday practice.
Okay, so to break it down, we have you find your fellow researcher, you do your needs assessment, you come up with a shared goal, then the researcher comes up with the protocol, because that's you're the researcher, because you either have an intervention or approach or something that you're wanting to test. All right, and so then the clinicians, the school-based clinicians, are looking at that protocol, and so then do you guys come together for that intervention science? Or are you telling the clinician the intervention, the steps that they need to take, or are you doing that together?
It depends.
Okay.
Yeah, it depends. And I think a lot of this is, it depends on what the project is, what the needs of the school are, what the needs of the learners are. And I see Alyssa has a question in here that kind of connects to all of this as well. A lot of this is context dependent. When we can work on this, how much time we can spend on all this is really, really dependent on the contexts we're in. So that's one of those things that depends.
Gotcha. And those that are just going to be listening, Alyssa, thank you for the question. And this is really important. She was wanting to know, does most of the collaboration happen during the school day or after hours? Are there grants you're accessing, and who's funding this collaboration? Oh, that's some really good questions there. And I know that a lot of it's going to be it depends. It depends on your school, depends on what the topic is, what your research scope is. But what worked for you guys?
Yeah, I mean, in our instance, I think, and I'm not too sure, my immediate assumption is that we shouldn't be, as the school-based practitioners, funding much of anything, really.
Thank you
Okay,
for that
got
answer.
it.
That's what I wanted to hear.
Yeah, okay, and I see a thumbs up from Tim. So, it's not meant to add anything more to our plate. It's meant to enrich it. And so we, on our end, we got, commitment from us as clinicians that we would be able to meet. And it wasn't even scheduled. It was just that we intend to do this, because one of the things that comes up is that, and I think one of the challenges around these are the logistics around scheduling and the demands, like you've got IEP meetings and you've got things like that, and students are out. And so, it really is just more of like a memorandum of understanding of sorts, that this is what we intend to do. And then, then Tim has helped secure any of the apps. There's been no pressure on us to purchase anything extra. And so it really is an added benefit, and it should be. This shouldn't be taxing the practicing clinician at all. It should be enriching. And so it's not, that's really very much the university, and Tim has access to funding and things like that we don't have. So I hope that answered that question.
It did, and it made me very happy because what I'm hearing is you're saying that the researcher is value add without adding a value to us. I mean, that was really cool in my head and it didn't come out right. Without a cost value to us is what I meant to say. And that is what we wanted to hear. Because if you're saying, Tim, you're bringing in everything, it's not a cost to us, because schools, our budgets are tight. And that is not feasible or sustainable to expect a clinician that is a school-based clinician to be funding this or finding the funding source. Ain't got time for that, sorry. But what I do have time is to collaborate with you, bringing in the value, and then we're adding to it because we're adding the implementation science. I love that.
I want to add in a great quote from Dr. Nicole Patenteri, who's a special education researcher in Florida, and she does incredible partnership work with a lot of school districts in her area. And one thing she says is funding is necessary to sustain, but not to begin. If you're doing it just because you got a grant, you're not building an authentic partnership. The funding matters, but you want to be there for the long run. And I think that's a commitment that, as a clinician, when you're talking to researchers, needs to be really clear up front that, we're not here to just collect data from you. We're here to be partners. And this is, I think that funding is a huge barrier to this kind of work, which is why not a lot of it gets done. Also, the work ends up getting messy because, I think Nerissa and Julia are great about making time for me, but it's also not always easy for us all to make time for one another. It does take effort, and I think that effort pays off for us all in different ways, but there isn't a very, very clear path forward. People need to be committed to this and want to do it and carve out that time, make that space, find that money after, to continue to sustain the relationship as it becomes built.
I love this. Okay. So Carolyn again has to put it in. So the challenge is funding for one, and and the answer to that was it's coming from the researcher side because schools don't have that and you guys can do the grants. But then the second one was time, because all of us working clinicians know we don't have time. But Nerissa, I loved when you said we need to have a memorandum of understanding, that there is going to be a time commitment, but it needs to be mutually agreeable and mutually beneficial. And I think all of us would say, when we're more apt to do more when we feel that that we're getting the benefit from it. And I think everything you're saying is, I'm just hearing value add, because we are charged as clinicians to give back to our profession and to be utilizing evidence-based practices. And that missing piece that I think we're all here for is, how does it relate to school-based clinicians? Because there's a lot of research going on about all sorts of stuff, but so I did the two challenges, really, funding and time. Those are the big ones, right? So I guess I'm trying to bring us to all the benefits now to doing this, which is being a part of something big, being a part of that evidence-based practice discovery. Let's talk more about benefits. Go.
I think of what we kind of started off by this podcast with is just talking about how, we all are really passionate about doing good work. And to do that, you do need to stay on top of the latest research, the latest evidence, and you don't want to stay stale in your ways. But we do see that it takes, and we all feel it too, it takes so much time and effort to stay on top of that job of ours that is a part of our job. And so the benefit of having this collaborative practice is that we're doing good on both sides. We're doing our job really good clinically, and then, we're giving back to research in the same way.
A question that I have okay. So I know you have a high incident of AAC users, so you guys collaborated that way. maybe this actually is to Tim. If I, being a clinician, and let's say I've got a new dealing with a group, a population that I might not have as much knowledge of. It could be, maybe it's apraxia, or some, I'm just pulling something out. Just a topic that maybe might not be my specialty. Could I be a good partnership with a researcher if I don't have that as my specialty? Did I ask that question? Did that make sense?
Yeah, I think your question makes sense. What I'm hearing from it is that, though, that it might not be a huge passion as far as what you want to get into within the discipline, and therefore maybe it's not actually going to make sense for you in the long run to get into a research practice partnership if maybe that's not the clinical population with whom you want to work. I think this makes the most sense when the population that you're going to study together represents a lot of your workload.
No. Yeah, no,
Yeah.
I was saying, like, if it's I'm starting in a new district or a new school, and the population is different, and I'm wanting more support, and because this is now a population I'm going to be servicing, so I want to make sure that I'm servicing them well. Would I be a good partnership for a researcher to come? Would that help my practice and build my expertise?
Going to give you, and it depends. I think a lot of that comes back to the person. It comes back to the commitment you want to make at that point. I think it could be, but I also think engaging in just initial PDs could also be an important part there.
Sure.
I also want to appreciate something Julia just mentioned, though. Julia was talking a lot about how these collaborations help us reinforce that external evidence base, the research that gets published all the time. But I think the thing that the researcher really gets out of this, and I think relates back to what you're talking about too, Carolyn, is that the researcher also gets a much firmer reality of how their research can be applied, and a better understanding of what clinical practice looks like, because we know that internal evidence is also a huge part of evidence-based practice. And it's really, really valuable for me to be in spaces where I'm seeing people building their own internal evidence base, thinking about their clients' perspectives actively every day in every action they take. That really, really helps ground me in the work that I try to do. And then related to, if I'm a person who maybe is in a brand new clinical world, I'm maybe interested in getting deeper into it, getting into that research practice partnership. Something that the three of us have started together is building a community of practice out here for AAC practitioners. We know that so many SLPs across the country feel really, really siloed, especially in school-based practice, especially in places where there's just a lot of space between schools, right? So that's kind of another, not necessarily research practice partnership we're in, but a way in which we're sharing ideas and things like that. Do either of you want to speak to a little bit about what that looks like and why that is beneficial for all of us?
Yeah, I did just want to loop back into what you were, I think, asking Carolyn about the, like learning something new. I think I can relate to what you're saying. In our practice, we really, really specialize in language. And it wasn't really until we started a school that we were like, whoa, we've got to really get into more of those, because like we, really helping the literacy and the going beyond what we were very comfortable with. And so, I mean, I can say like really confidently, like what I have learned as, I don't often like to do this, but as like a PhD level SLP who's been doing this for way longer than my dyed hair will ever like admit, is I've learned so much from Tim in a really short period of time. And I think the fact that like I think it's really beneficial for practicing clinicians, because I am getting tailored research delivered to me with my own personal questions. I don't even have to make that leap, having gone to a 3-day training and being like, okay, this doesn't really apply to my learner, but I think I can draw the parallels. I am like literally getting it right where I need it and repeatedly. And so I think that it really does benefit us clinically. And I think I've kind of lost, because I feel really passionate about that, so I may have lost a little bit of direction. But I also feel as a PhD level SLP that as a body of practicing speech language pathologists, we should invite researchers into our offices and into our intervention rooms way as often as we can, because otherwise the science just isn't really relevant. It's not relevant. Like we can't replicate those same things. It's just the conditions are so different. And so I feel like we get really meaningful information. And one of the things that I love about Tim is that, and what I've learned in this process, I'll be like, oh, okay, so we aren't getting enough data points and they didn't do it this day. And he's like, nope, that's good, because now we know, like, this is, I think even at the start, like we put this app on and the iPads, like, didn't have enough storage space. And so he was like, great, that's a data point for me. Like, failure or problems are so informative, and we wouldn't have recognized that if we weren't running this with multiple students with, if we would just had a sample of 3 or 4 in the clinic and everyone had a one-to-one iPad, then they didn't have to share. We would never come across this major limitation where we are sharing a small handful of 5 across 30 kids. So I think it's a really dynamic process that actually ends up helping us as practicing clinicians, I think, more than the researchers, because it's really hard work for them.
Sure.
But we got a lot to gain from it ourselves.
So I'm hearing benefits for researchers, benefits for clinicians, but most important now, I don't want to end without talking about what is the benefit for the students, because ultimately we're here for the students. We're all here for us, and I love that too. But let's tell me how does it benefit our students? That's going to be the clincher.
I'm going to start by saying how hopefully the researcher is going to come in thinking about things, and things as clinicians you might want to make sure you're asking. I know we talked a lot about how science has to happen in the real world in order for it to be most applicable. However, we also need enough evidence before we bring it into the real world to know that it's going to be worthwhile to actually try there. So there is that need for more lab-based science, oftentimes prior to these innovations being studied in the real world setting. So it's always something to kind of ask about if you're a clinician and being approached by a researcher who wants to try something with you. Hey, can you tell me more about the evidence about why we think this could work here? Is probably a good place to start. And that's the first piece to answer your question about, could this actually benefit our students? Yeah, we have some evidence from a lab, from it being implemented in X, Y, or Z ways, that it can benefit our students. Now we want to see if that same thing can be replicated here in the setting. What else are you all thinking about for ways that benefit students? Hopefully there are ways, right?
Julia, this is your moment as someone who is so passionate. I mean, go for it. How does it benefit our students?
Oh my goodness. Okay, so it's I just feel like, Nerissa, you did such a good job explaining this before. Tailored implementation science in our lab for that student. Like, our students are so gosh darn complex, and one size does not fit all. They are so different, no, regardless of the presentation. So even if it's DLD, if it's AAC, if it's apraxia, any ARTIC, one implementation strategy that you use with one student isn't necessarily going to work with another student. We all know that. We've all been there, been through it. And so I like, to the audience, like, if you read an article or you see on like a Facebook group that, oh, try this implementation strategy, and you go in and you try it with your student, but maybe your student has CP and he can't access it the way that maybe you read the student in the Facebook group could access it, right? I write back to the researcher and say, hey, I have this individual, this is what they're presenting with, and it didn't quite work the way that I want it to work, but maybe this would offer you really nice research practice. And then the student benefits because they're getting tailored intervention, and it's backed by evidence, and you're closely tied with a researcher who is knowledgeable about the research that backs that implementation strategy. And so you're using your clinical expertise, your clinical judgment, and it's backed by evidence. So it's a win-win all around.
I love it. So what I'm hearing is the benefit the student is it really is tailored to the student. This isn't a one size fits all situation. So you're not coming in saying, hey, do this implementation, boom, 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 boom. You're actually taking a look at each of the students that you're working with and making sure that it's going to work for them, and you're going to tweak it so that it works for them. I like that. I like that. I love this thought. I think we're all here going, I want to start this. I want to make a connection. Absolutely. But man, I I just want to keep going. But I know that we're kind of going to be wrapping up here in a minute. So, all right, I've got tons of questions, and maybe we'll just have to do another episode where Carolyn's questions are all answered. But no, not that you're leaving me with a bunch of questions, you're not. But if as we're leaving today, if you want to leave school-based clinicians, like how can they shift their thinking, or what could they do to get started with this? Where would, maybe if each of you can kind of, what's a walk away from a takeaway? If you guys would mind giving us each of you give us one or more takeaways of research practice partnerships.
I can start. I think the first takeaway would probably be really figuring out a needs assessment. So have a question in mind and then do your due diligence from there. And whether that's, going and researching on your own, like through PDs or Facebook groups, or reaching out to a researcher, I think that should be really your first step, is question.
Okay. Love it. Agreed.
Yeah, hard not, I mean, my thing I was thinking is like, just reach out. If the researcher writes back to you, they care. And it's going to, sorry, maybe that was a little too extreme, but they're available. And, I think that is a really good sign. Like if you initiate that because you found someone, because you were interested in this topic and you reached out to them and you get a response, that is, I think, a really good indication of what Tim had. I tried to write it down somewhere, but it was like, you've got the vulnerability. It's kind of like, oh, I don't know, I want to know more. And then you bid that out and it gets received. That's the beginning of, I think, that suggests that there is a lot of room for shared collaboration. So I would say just reach out. I've reached out to many, many people, which is how I started this. I'm like, let me see, is he going to write back? Because I most often don't get a return. I generally have not gotten a return email until I got Tim. So Tim, take it away.
I echo what Julia and Nerissa both shared so far. I really, really think that openness and that willingness to be vulnerable is massively important in beginning to build these relationships. Being able to, for both sides, being able to admit what we don't know and to talk with one another to learn about each other's context and how that can then shape what we understand about one another. I also really appreciate that Nerissa talks about just reaching out. I think that's our first step in getting into that vulnerable space, is just reaching out to talk about what we don't know. Like Julia said, having a really specific question in mind is often really helpful in shaping that. I think that there are a ton, especially, I think there are a ton of faculty out there, and I think that a lot who are newer faculty who are really, really interested in doing this work, who were clinicians themselves for many years and now are really invested in this. So there are a lot of good people out there. So keep reaching out, and hopefully we can continue making connections and continue developing science that benefits everyday learners.
I love it. And as I seem to always do, I'm going to bring this all together. So first, ask the question. Thank you, Julia. Ask a question. Nerissa, what I heard you say is we need to know what we don't know. And that is a sign of intelligence, is those that know what we don't know is how we grow. And then Tim reaching out. And I think that's giving us a lot of hope that there's a lot of us out there that have a specialty that are wanting to share. I'll say for me, when I've done my presentation, I'm very specialized, dysphagia in the schools. And when I give my email out, and when people reach out to me, I do answer. So I really do. And just the other day, I was talking with someone from California because I love the collaboration. And I think those that are listening are collaborators. Everyone that comes on the podcast are collaborators. And if I don't stop, I'm going to keep us here forever. I'm going to have to make us dinner. So I am going to need, oh my gosh, I don't want to wrap it up. I really don't, but I'm going to have to. Tim, thank you so much for coming again. You're always such a treat. I love everything you do and everything you say. So it's been wonderful to get you back on. And I love that you introduced us to Nerissa and Julia. You guys, your passion for what you do is amazing. Thank you so much. And I want to thank the listeners. I mean, thank you for being here. Thank you for listening and wanting to do this work. And thanks for the work we are all doing every single day, because the work that we do really is complex. But the one thing I want to say that what I heard throughout this whole time is our work is evolving. And that is why we need to keep up with evidence-based, because it's not the same as it once was, right? And the only way that we can do this sustainably and strong is for us to do it together. So don't be siloed. Reach out is what we're saying, right? Reach out. All right. So all y'all, thank you so much. If you are listening and you've loved this episode, please leave a review. Share it with a colleague. That's what we get. Let's get the word out. Share it with a colleague. I want to thank everybody. Until next time, keep learning boldly, keep questioning thoughtfully, and keep building relationships that our students deserve. Thank you so much. Bye, everyone.